Wait before we just go to the main part. Let me introduce myself. Hi, hello guys. This is Medbits, your exam savior, and today we're going to discuss hip joint complex part 2, one of the most weighted video of all time. And yes, please give your undivided attention to this. You'll have to be focused on this because every single topic in this is very much important. Now, those who haven't watched the part 1, please go and watch that. I'll be leaving the link in the description below, and please do watch it. It is very much important in order to understand part 2. So let's begin. So in last video, in part 1, we have discussed about what is hip joint complex, right? What is acetabulum? What's the role of head of femur, and what's head of femur? Then ligaments, and what all are the functions associating with it? Muscles and tendons. So I also have said about the muscles and tendons, what all are the functions, what all can happen, and all. So yeah, let's go to the next part. So guys, in part 2 we'll be discussing about acetabular abnormalities and hip degeneration. Then comes this acetabular dysplasia, coxa profunda, acetabular protrusion, angle of inclination of femur, Coxa Valga and Coxa Para, slip capital femoral epiphysis, anglofemoral torsion, antiversion and retroversion. So these all topics are very much important, as I've said in the first itself, that you'll have to know them. So yep, let's begin. Let's start with the first topic, which is acetabular abnormalities and hip degeneration. Acetabular dysplasia. So before I'm just going to start, please make sure that you have a paper or a book so that you could just write down these notes, or you could write lecture notes for the better understanding. So as usual, I'm just going to say that please do draw the diagrams as you can see here. Draw them, because that's how you're going to get real good marks. So yeah. So acetabular dysplasia or hip dysplasia is the disorder that occurs when the acetabulum, which is the hip socket, is shallow or smaller, right? As you can see, low coverage, the head cannot actually socket here, and doesn't provide sufficient coverage of the femoral head, right? So causing instability of the hip joint. Over time, this instability causes damage to the labrum and articulation surface, which can result in pain and development of early hip osteoarthritis. So now, what would be the reasons? Well, let's just pick them one by one, which is developmental disorder of hip, DDH, you can remember it that way, in childhood, and family history of osteoarthritis. Frontal hip or groin pain are the main symptom. So what are the diagnoses? It is by X-ray, MRI and checking range of motion. Treatment is reshaping acetabulum. So let's say it is periacetabular osteomy. Now coming up with the next topic, which is coxa profunda and acetabular protrusion. So in coxa profunda, in this condition, this is a situation with deep acetabular socket, which leads to reduced range of motion and impingement between femoral head, neck and acetabulum. So in this condition, like, it will just get really impinged, and yep, the tear can cause, and there are much more worse conditions, and the person starts to limp. So coming up with the next one is acetabular protrusion. So in this condition, acetabular protrusion is intrapelvic displacement of the acetabulum and femoral head, so that the femoral head projects medial to the ilioischial line. So in this condition, the person starts to limp, and yeah. So coming up with the next one, acetabular antiversion and acetabular retroversion. So now here we know that acetabulum is laterally inclined 50 degree, right? So anteriorly rotated 20 degree and anteriorly tilted 20 degree. If the acetabulum is anteriorly rotated more than 20 degree, it comes more closer to the frontal plane. In such case, femur can't get articulated well, which leads to instability of the joint, right? So the femoral head will not be able to articulate with the acetabulum if it goes to the frontal plane, right? So yeah, so in acetabular retroversion, this is the opposite of antiversion. Here, acetabulum gets positioned posteriorly, which results in over coverage of head and neck of femur, leading to impingement and degeneration. Angle of inclination of femur. So in here, angle of inclination occurs in the frontal plane between an axis through the femoral head and neck and the longitudinal axis of the femoral shaft. So we all have a normal angle of inclination which comes to 125 degree. So yeah, so there will be conditions that we'll be discussing about what happens if it goes more than 125 and less than 125. So let's continue. Normal value of angle of inclination is 125 degree, as I've said. So depends on individuals. So it varies between 110 to 144 degree. So angle of inclination is lesser in female. So angle of inclination can be different for both hip joints also too. So it can happen in that way also too. So angle of inclination is higher in childhood and gets confined to 125 degree during skeletal maturity. So this is also another way. So we all have gone through this stage. So yeah. So increase in angle of inclination is Coxa Valga. Increase is Coxa Valga. So decrease in angle of inclination is Coxa Para. Coxa Para. So let's continue with the next one. So let's begin with Coxa Valga. So as I have said earlier, this is a condition where angle of inclination is more than 125 degree. It is called Coxa Valga. So these are the conditions that's going to happen in Coxa Valga. So first one is decrease in stability as articulation contact area is less. Bone weakens as trabecular system density reduces. So the trabecular system is how we get the nourishment to the head and the neck of the femur, so on. Then momentum of the abductor muscles reduces, results in lower muscular efficiency and stability. Since abduction muscles are weakened, same repeats with adduction muscles and instability increases. So due to degeneration, joint reaction force increases, which in turn leads to bone damage in joints. So the labrum gets teared, leading to acetabular labrum tear. Then length of the femur increases slightly and hence person limbs. Coming up with the next one, which is Coxa Para. So in this condition where angle of inclination is less than 120 degree, so which is called as Coxa Para. So this can happen in congenital stage, which is developmental stage, or due to acquired diseases such as rickets and vitamin deficiency. So here we have two factors, positive and negative factors. So let's start with the positive factor. So as you can see here, this is the normal angle of inclination, which is 125. So here it gets less, so it goes to 105, so on and so. So let's begin. Since femur head gets more into acetabulum, joint congruence increases and hence the stability also too. So the muscle strength increases as momentum is increased. Adduction and abduction muscles also get stronger. That's a good news. Due to increase in joint reaction force, no degeneration of acetabulum happens. So this is complete opposite of Coxa Valga, right? So now let's go with the negative factors. Now, chance of femur head neck fracture. It can happen due to high body mass. People, those who have high body mass, obesity, they face this. And femur length reduces and person limps. And SCFE, slipped capital femoral epiphysis, which we'll be seeing in the coming slides. Slipped capital femoral epiphysis. So, slipped capital femoral epiphysis, also let's say it as SCFE, a disorder of adolescence in which the growth plate is damaged and the femoral head moves, with respect to the rest of the femur. The head of the femur stays in the cup of the hip joint while the rest of the femur is shifted. As you can see, this is what will happen. Now it's stable, and when it goes unstable, it slips like this and it stays in the cup. The head of the femur stays in the cup. So Coxa Para and obesity are the main causes so far predicted. So these are the symptoms now I'm going to say out that we can observe too. So pain on hip, medial thigh pain and knee along with onset limping and decreased range of motions are the symptoms. So what are the treatments that now we can give it on SCFE? So the goal for treatment is to prevent the femoral head from slipping any further and avoid complications. So this is accomplished with surgery. A screw is inserted to connect the femoral head with the rest of the femur. So this is the reasons why all the physical therapists or any other medical professionals say that to stay healthy so that you don't go any higher with BMI or anything, so that this can also happen. Anglofemoral torsion. So anglofemoral torsion is the angle between lateral condyle axis and femoral head neck axis. Anglofemoral torsion is a normal torsion or twist present in femur that plays an important role in stability and function of the hip joint. So angle of torsion increases with age. Normal value for male is 10 to 20 degree. So female is 15 to 18 degree. During infancy, angle of torsion is between 30 to 40 degree. Antiversion of femur. So antiversion of femur is a condition where anglofemoral torsion is greater than 20 degree. So this leads to instability of joint as more articulating surface is exposed. Abductor muscle inclination in hip changes. Hence, line of pull decreases results in low momentum. Gradually develop to arthritis due to low momentum and unbalanced torque. Toe moves inward resulting in gait changes. Retroversion of femur. So retroversion of femur is just the opposite of anteversion of femur. So retroversion of femur is a condition where angle of torsion is less than 10 degree. So this leads to labrum damage and tear. Impingement of femoral head occurs due to more congruency, as we have discussed. Then toe points outward resulting in gait change. Congratulations guys, you have completed hip joint complex, and I hope you all have understood the concept very well, and you all are gonna do exam very well, and I'm really sure about it. And until then, we'll see you on next video. So if you think that this video has become really helpful, so do share and like, subscribe. So yeah, see you next video. Bye.